My name is Jakari Harris. I'm the marketing manager for Zeely, and I want to welcome you to the Revenue Prediction Tools webinar with Ali Beheshti. In today's webinar, you're going to learn how to maximize your earning potential with revenue prediction tools. And so for today's agenda, Ali is going to cover several areas, including the problem that behavioral health treatment centers are currently facing. He's also going to discuss the solution for those problems. He's also going to give a breakdown of the revenue prediction tools, and he'll explain exactly what they are. We also have a case study as well as a Q&A that's going to happen at the end of the event. So if you have any questions throughout the event, please put them in the chat box at the bottom of your Zoom window, and we'll get to all the questions at the end of the event. And then, of course, be sure to stick around for that $100 Amazon gift card contest. And once again, if you could please update your screen name to your actual name and your company name, that way we can get you entered into the contest. And so without further ado, here's Mr. Ali Beheshti.
Hi, thank you, Jakari, for that introduction. Like Jakari said, my name's Ali Beheshti. I'm the CEO of Zeely. I actually used to be the CEO of a behavioral health treatment center myself. I actually got into the sector by happenstance about 7-8 years ago now. My sister was a doctor in this sector. She was the medical director of a few behavioral health centers. And she wanted to start a center of her own for outpatient care for psychiatric, because she was a psychiatrist, for the PHP and IOP levels of care. I ended up, because I have a law degree, she asked me to help her with the regulatory compliance. I ended up becoming the CEO of that company and running the business side for her. And it was there that I discovered the lack of sophistication of billing in this sector, and the lack of transparency and the lack of data analytics. So it was quite surprising to me. And it was there that we eventually developed our own in-house billing department and started developing some of the software and data analytic platform that would later become the core of Zeely. And Zeely I started 3 years ago because I wanted to build the tools that I, as an owner-operator, used to be owner-operator, would want and needed. And that is where Zeely came from, and that's how it started. So thank you for taking the time for being here. Throughout this presentation, we're going to be talking about one huge problem that exists in this sector, and that's the unknown reimbursement rates prior to admission. And then we're going to talk about some of the Zeely solutions, some of the tools we've created. For those of you that aren't Zeely's clients or won't be using Zeely services, we'll also be talking about ways you yourself can have use data to you have a kind of like a Zeely light, so you can understand the basic underlying principles and see how important data is in driving your business. So just to start, I want to talk about the problem, and that problem, the unknown reimbursement rate problem. It's because of two reasons. When I entered this space, we noticed that the facilities are unique in that most of the facilities are, it's a fragmented sector, so they're not in network with a majority of payers. They may have one or two in-network contracts with one or two payers, but not all payers. And so that's unique to this space. And obviously some of the contracts we've seen, that the ones that do have in-network contracts have very bad in-network contracts. So that's not unique to this space, but it is definitely prevalent in this sector. So that's one thing that's unique about this space. And then the other thing is the unique patient population. So the unique patient population is due to the fact that they are well insured, oftentimes, with good health insurance policies because, many reasons. They're on their spouses, they're on their parents, or they just, they have a job of their own. However, because of the reason they're seeking treatment, whether it's a mental health disorder or more oftentimes a substance use disorder issue, they are financially destitute and unable to make up the entire patient portion, especially if they go to an out-of-network provider and that patient portion is large. So If you don't know what you're going to get paid from insurance because you don't have an in-network contract and the patient can't make up the entire difference, then oftentimes you're flying blind. You don't know what you're going to get paid for the services you provide. And that is obviously very difficult to operate a business in such an environment. It's difficult to ascertain prior to admitting a patient, what am I going to get reimbursed for my services? It's difficult to calculate future revenues. So all of these are issues that are very unique to this sector and need to have unique solutions designed specifically for this sector. So I'll talk about Zealy's underlying solution, and bottom line is it's data. First, you have to have historical data stored in a manner that's easy to analyze. So historical data needs to be in your database in a way where every field is distinctive and properly labeled so that later on you can access that data and write analytics platforms and algorithms to read that data. One of the things I've noticed is that even with larger providers, we've audited actually one of the largest providers in the United States, is that their database could be full of dirty data. In fact, we had to rebuild that particular facility's database from scratch because the clearinghouse was transmitting the data in the wrong fields, and they were storing certain data like the allowable rate in the wrong fields in their database, and therefore we had to rebuild it. Luckily, there are APIs, application program interfaces, where you can call the payer's database and extract information. So we were able to fill their database with the proper information and reorganize it. And so it's very important that your historical data is structured accurately and easy to write analytics over or algorithms over. So speaking of analytics, that's the second component. So historical data needs to be created into subsets so that those can be analyzed. And again, that has a lot to do with how your database is structured. And it also, for us, for example, it's not just your reimbursement database. We also have a database completely where it reads all the information through a verification of benefits process so that those two databases can talk to each other. So we can say, what information did we extract through the verification of benefits? And we'll show you this later, and access the reimbursement database and have those databases talk to each other. So it's, that's where the analytics come in. So then once you have that and you create these subsets and you can allow your databases to talk to each other, you can have predictive algorithms. So we then take that information and those analytics, and we can write code to read it and predict outcomes. For example, a product we'll show you is Smart BOB. It's just reading historical data, analyzing it, and giving you that data in a fashion that you can then look at it and say, oh, if this policy is similar to those policies that they are referencing in their database, it should give me a good guide into what I'll get reimbursed moving forward. And once you have those algorithms in place, then you can create user interfaces and predictive tools. That's the revenue prediction tools that we're going to be looking at, by using those algorithms and having it in a way that's easy to interact with, right? So a few of the tools we're going to be talking about today are Smart BOB, which I'll show you now, and then we're going to talk about what's called Alpha Tracker, and then Alpha Prefix Tracker, and then Payer Tracker. So we'll start with the first revenue prediction tool we're going to talk about is Smart BOB. And the way Smart BOB works is that, as I mentioned earlier, we have historical data that we reference in our database for reimbursements, but we also have a database which stores the responses we receive in the verification of benefits process. And it's very important that this database be structured properly as well, because you want to make sure all these fields, the responses, okay, have to be stored. And if you can, you want to make all these responses, as we do, if it's applicable, you want to make them drop downs. And the reason it's important to make the responses drop downs is due to the fact that when you store it in your database, if you want your predictive algorithms to read them later, it's much easier for those algorithms to read data that is uniform. So that's why it's great to have yes or no questions. It's great to have questions that have a finite number of responses. You can't always do that, but you can make the box is payer specific and then have finite responses for that payer. And all these things when creating your database are really important. That's what we did here at Zeely. So for example, this particular, what you're looking at on the left, those are the responses on the second page. Our verification of benefits is about 2 pages because we asked quite a few questions. And then in the bottom right-hand corner is what we call Smart VOB, where once we get those responses through the verification of benefits process, it then takes that information, calls 2 databases, one, the verification of benefits database, and says, historically speaking, policies that had these responses, now call the reimbursement. Tell me, what did they pay, right? So it takes the responses throughout the verification of benefits process and calls the database and gets reimbursement rates based off that. So this is one of the tools that can be developed using predictive algorithms if you have proper data stored and you create a system where you can extract information through the verification of benefits process. Now, for those of you who don't use Zeely or and attempting to do something of this nature, obviously I understand this is a highly complex system we've developed using software developers and data analytics and data scientists. However, on a much smaller scale, it took human beings to, for example, to determine which one of these boxes was determinative in reimbursements, right? So you can, if you understand that information you gather through the verification of benefits process has a direct correlation to reimbursement rates and outcomes, and you know what those correlations are, you can start tracking it on a much less sophisticated level. For example, if you break it out, if you look at this one, Cigna, is it an MRC2 policy? Historically, what have we seen those payments? United, is it a MNRP policy? If it's an Aetna, does it have facility charge review? Is it a renegotiable policy? Does it participate in third-party administration? All of these things, as well as the rate type, many other factors come into play, have direct correlations to reimbursement rates. So knowing that information prior to admission is important. Obviously, here we've gone a few steps further and created an entire platform that uses that data to give you predictive outcomes. We tell you how much data we reference and we tell you the numbers. Obviously, if it's a small data set, it's a very limited guide. If it's a much larger data set, it's a more accurate guide and what you might expect. Obviously, it's not perfect. Policies are different one from the other for out-of-network providers. Also, your contractual arrangements, which we at Zeely like to make sure if you have third-party agreements in place which govern these out-of-network payments, those are going to have a direct effect. We've had to unwind a few of those third-party agreements and renegotiate them quite a few times in the past. But once you have those in place, as well as your in-network contracts are obviously easy to predict the revenue off of those. Once those are in place, you can really start using that data to predict future reimbursement on a micro scale, on a patient-to-patient basis, but also on a macro scale. So you can have a better understanding of what is my company as a whole going to get reimbursed for my services this prior month, and project things like that forward. Obviously, again, these are tools, they're not perfect, but it does give you a guide for when, honestly, most facilities are flying blind without this information. So it's very important. Next, we're going to talk about a revenue prediction tool we call Alpha Prefix Tracker. What we're showing you here is the presentation of that tool in our mobile application. So Zeely not only stores all your data in a database and presents it to you through the web, but we also through a website. We also present it through a mobile application. It's in the App Store. You can download it if you use our tools internally. And so the great thing for this one in particular, this applies to Anthem Blue Cross Blue Shield policies. And Anthem Blue Cross Blue Shield, we've noticed the largest correlation between reimbursement and Anthem Blue Cross Blue Shield policies to out-of-network providers is the alpha prefix that starts the card starts with. So the member ID on the card will start with those 3 letters. Sometimes it's 1 letter, sometimes it's 5, but really the 3-letter alpha prefix is the most common. And we've created this tool where you can simply type in that alpha prefix into the mobile application or the web application, and it'll tell you if we have historical data on that particular policy. How much data do we have? How much did it historically reimburse all of our clients, right? We aggregated across all our clients, so we have hundreds of millions of dollars worth of data on this. Again, for those of you who are not using Zeely services, you can also, on again a much micro scale, use your own data and start mapping this information in your own database and see historically how have you done with particular alphas. Obviously, your data set's not going to be nearly as large as ours, but it gives you a guide. It's a good thing to just have data, just to understand it and have those predictive analytics there, so you can make more educated business decisions upon admission. So that's Anthem Blue Cross. Also great for if you ever want to negotiate in-network contracts, knowing historically what have I been getting paid on these particular policies, so you can at least know entering into that negotiation, am I negotiating for a lower rate, a higher rate? And there's pros and cons of going in network that are unrelated to reimbursement, such as being able to take HMOs and EPOs and things of that nature. So all of that needs to be weighted out when you're making that decision. But again, all business decisions in this sector, in all sectors, but very much so in this sector because of the unique situation, should be data-driven decisions. So that's pretty much the crux of what we're going to be talking about, the data. And we also have a revenue prediction tool very similar to Alpha Tracker, except we call it Payer Tracker. And Payer Tracker is very useful for those small payers. There's many of them floating around. You've never heard of them before. Maybe you've had one or two, but you didn't store the data on it, so you don't know. We aggregate this again across all of our clients, so we can have a large enough data set to say, historically speaking, this small payer has paid X amount of dollars for the same services you provide. It's been a very useful tool because, again, these don't come up that often. So when you get them, you may not remember what you got reimbursed historically, or maybe you've never had one. So being able to access a much larger data set there is very important. And both the Alpha Prefix and Payer Tracker tools are important because even though a lot of this information is in that Smart VOB tool that I showed you at the beginning, it does reference this information, especially the Alpha Tracker for Blues, because like I said before, it has the largest correlation with reimbursement rates, is that you can access these tools 24/7. So if it's the evening or the weekend and you're unable to get a manual verification of benefits because the payers aren't open, you can access this data and still make an educated business decision when doing admission. You can also, through the mobile app, check the benefits to make sure the policy is active, it covers the services you provide, how much is remaining on the deductible and coinsurance, things of that nature, so you can make an educated decision when a lot of the times the patient population is in an emergency and they simply can't wait, especially if it's the weekend, they can't wait till Monday for you to run a verification of benefits. So sometimes you have to make that decision on the fly, and having access to data and easily being able to ascertain potential reimbursement rates. Again, not as useful as the Smart VOB, but quite useful when you're unable to get your hands on that because the payer is not open. And again, with Payer Tracker, if you're a smaller facility or you don't use our services, you still probably have some of these policies in your historical data. You need to store that data so you can reference it easily the next time you come across that policy, so you don't have to guess. It's all about taking the guesswork out of the process so you can have a better understanding of what is my potential revenue from the insurance company, because like I said at the beginning, oftentimes the patient population in this sector is not going to be able to make up the entire difference between what you billed the payer and what was reimbursed by the payer. And that number can be a significant number sometimes. So it's very important to know that prior to admission. So here's a case study of actually one of our facilities. It was a 12-bed facility. It's actually 2 6-bed facilities, but owned by the same company. They are residential detox facilities. And when they came to us, before they, they had no transparency, they had no data, they were using another third party service provider for their billing services. They were always full. The interesting thing is they were always full. They billed about $1.5 million in claims per month. They they were so full, oftentimes they had a waiting list. However, their entire collections percentage when we did it was approximately close to 20%. And 20% of 1.5 million is 300,000, which doesn't sound that bad, but when you took in their overhead costs of running both those facilities combined, it was about 250,000 just in labor and all the other overhead that goes in. And they were also, in addition to that, spending about $75,000 a month on marketing. So their net profit was actually, they were in the red. They were losing about 25,000 on average when we went back and looked at their historical data, and they told us their overhead costs and their marketing costs. They were losing money month over month, and they couldn't understand it because they were full. And this was a particular facility that really took to understanding the data, using it to their advantage for admissions. We explained to them a lot of these policies that you're seeing are also renegotiable. So we renegotiate a lot of claims after they pay, Aetna being the most common one because they fall under ERISA and have what are called patient advocates, frequently renegotiable. A lot of policies that are governed by multi-plan are renegotiable even prior to the initial payment, sometimes even after post-payment. So especially if there's inconsistencies in the allowable rates. So they really understood that and took the data and started using the tools. So the three I mentioned, but there's more tools than that as well. And they were able to, this is actually only after about 6 months, a little, approximately 6 months later, they were still billing at the same 1.5 million a month because they were still the same size, 12 beds, and they were always full still. However, they were able to get their revenue closer to 50%, we'll say 45 to be a little conservative, around the 45% collection rate. And 45% of 1.5 million, $675,000. Now their overhead did not change at all. They did invest more in marketing. And the reason they invested more in marketing is because when you do a lot of data-driven admissions, oftentimes you're going to have to say, listen, the costs, it's going to cost us more to treat you than we're going to get reimbursed by your insurance. Are you going to be able to make up the entire difference? A lot of patients aren't able to. So a lot of filtering happens where those patients kind of they go to in-network providers or they go somewhere else that may be not as sophisticated and doesn't realize they're going to take a loss on that patient if the patient's unable to make up the difference. So they did increase their marketing. They actually doubled their marketing budget. They told me that. However, even doing that, their net profit was $275,000. So they went from losing $25,000 a month to gaining to 175. So, it's a $300,000 shift. And again, they did not increase in size. They are the exact same size today as they were when they came on board with us. So just tells you how much being data driven and understanding the process is so important in marketing, admissions, and pretty much everything in your business. But really, when it comes to this space, those two factors are incredibly important in those two spaces. So sorry, I know I rushed through that. So we're going to come here to the Q&A section. But before that, I just want to mention, if you want to learn more about Zeely or our services, you feel free to call us at that 1-800 number that's on the screen, or just email us at info@zeely.com if you have more questions or want to sign up for our services. You can simply email or call those numbers there. Or you can stay on after the Q&A that we're about to do and discuss it with us then and get into more detail. Obviously, some of the questions you may have that are more detailed, you may not want to ask with more people on this. So you can wait till the end and ask us at that point. Okay, so thank you so much for your time. I'm going to go to Jakari because I know he may have been monitoring the questions throughout the process here. Jakari, you there?
Yes, I'm here. Yeah, we don't have any questions at this time. Gregory, if you have any questions, please feel free to ask them now. We would definitely love to get your feedback and answer any, questions that you may have.
Or anyone else here?
Or anyone else.
No, just saw his name up there. Okay, it seems like, just so you know, a lot of people are muted. I don't know if they know that, but I don't know if you did that, Jakari, but I just wanted to thank you guys again for taking the time.
I'm sorry, I had a question.
Oh, wait, here we go. Got a question.
Hello, Doug from BNI.
Hi, Doug.
Hey, so with the smart VOB, has absolutely been fantastic for me.
Okay.
But quick question. I know there's been 1 or 2 times where the data shows, a good allowable amount percentage. Yeah. And then when we actually get paid, it's much smaller, and maybe like they made a change in their, practice or whatever.
Sure.
So if something like that happens, like if an insurance company is paying whatever 60% allowed.
Yeah.
But maybe internally they change things around. So we bring in somebody thinking it's going to be 60%, and then it turns out to be like 20%.
Yeah.
Will that change be reflected as like a new permanence, or will it just kind of go into the average and bring it down a little bit, but not really reflect the new deal?
So that's a great question. So it's 2 functions. If it falls significantly outside what we call 2 standard deviations, it'll get flagged in our system, right? So it will feed into the total data for sure. But if it falls significantly outside, it'll be flagged. And then if we get 2 standard, like again, it happens, another standard deviation, and not just at your facility, it's aggregate, right? Then we have to look at it and keep in mind the data is actually burning off too. So we don't do a tail more than 12 months. So the newer data will start skewing the data in one direction. But if it falls that far outside the norm and it's not renegotiable, right? So a lot of them are renegotiable, as you know. So sometimes they'll come in under the norm, and then we'll renegotiate them up to the norm. But let's assume it's not renegotiable up to the norm. Then our system will flag it. And then if it's a complete system-wide change, we'll actually burn all the old data and only use new data. So the data set you'll see sometimes, probably Doug, you'll be like, oh, it referenced such a small data set when like 2 months ago for a very similar policy, it was almost millions of dollars worth of data. And that's because we had to scrub out a lot of old, what at that point, if it's a systemic change at the payer with a particular type of policy, you'll see it'll completely get scrubbed out of the system. So we kind of have to restart building that data set all over again. So you may notice sometimes, wow, that data set shrunk. And that's because we had to burn off a bunch of old data.
Okay. And then is that something that your super crazy algorithm thing that I wouldn't be able to understand does automatically, or do we have to like, send you guys an email, hey, this said this?
It flags it automatically, right? But we have to then, the human beings that then have to go look at it and say why, right? So we have to understand what's the underlying. The computer is not sophisticated enough to understand the why. It can just, it'll only understand the how, right? It happened. Now we have to go look in, is this an outlier or is this systemic, right? And the more data we get, we can determine, is it an outlier or is it systemic? More often than not, it's an outlier. It's a unique situation with that particular policy. However, sometimes, and the one that's the most common is actually Anthem Blue Cross, it's systemic, but we know the date typically that they make a systemic change, it's March 1st of every year. So we're actually on lookout for that one. So sometimes for example, you may see the suggested rates change for blues, and that's because that was a systemic change. That's one we anticipate, but with other ones, the most difficult one to ascertain when they make a systemic change is actually Aetna. So that's the one that like oftentimes we have to look at really closely. But Optum, made a systemic change last year in October. You may have noticed the data set shrink for a while until we had to re-push in some new data. It was only applicable to MNRP policies, but it was a significant change in MNRP policies, although only for outpatient levels of care. So actually you wouldn't have noticed at all in that particular one. But yeah, so it is, even though the system will catch it, you don't have to notify us. I mean,
Okay.
if, our system is catching it, but it's always good to ask those questions anyway, if you're curious. And honestly, someone like yourself, I know you've become far more sophisticated. So the questions you're asking are actually quite good. When you're emailing, I think you've probably become one of the experts using the system. So,
well, I appreciate you always pointing me in the right direction too.
Sure, no problem, of course. So, go ahead. What's the other one?
Same thing with the Aetna repricing.
Yeah.
Policies. That's something that you guys just automatically take note of and then renegotiate down the road.
Yes, always. That's actually, we have an algorithm specifically for that one, as well as Optum and Cigna. They have we have what's called an inconsistent pricing algorithm that goes in and reads the allowable rates, whether they were whether those rates were negotiated with the payer or with the third-party administrator, and then says if there's inconsistencies, and then we do what's called the inconsistencies audit, and then renegotiate those as well. So yeah, there's separate algorithms for separate functions. There's no need to point that out to us. The inconsistent one happens quarterly, and the Aetna one I mentioned, because those are more time sensitive, happen monthly.
Right. So as far as if I get a VOB and it's a repricing policy, a month after they leave the facility, our administrator doesn't need to email you guys, hey, can we look at that renegotiation? You guys just
No, it's going to automatically trigger in our system.
Yeah.
So it takes the previous month's reimbursements, it creates a renegotiation file, and then it goes to our renegotiation department, and they just automatically renegotiate.
Okay.
Yeah. Same thing with those inconsistencies as well, by the way. Hey, we got someone else joined by video here.
Hey, Peter Gates of Pillars Recovery.
Hey, Peter, how are you?
Good. I missed the first part of the presentation. I apologize for that.
Sure. You want me to go back and do the whole thing for you?
Yeah. Thank you. Thank you, though. Super helpful, all that information. I got to say, in my our first year with Zeely, and maybe you'll do a follow-up. I think sort of my second year, the follow-up to this is sort of the trends dashboard, Ali. Super helpful to see where the payers are coming from with the mix of payers. Spend a lot of time and get a lot of value out of that these days.
Yeah, that's a good point. The more time you spend with us, and the more sophisticated you become, if you start tracking those trends, you can, which we present in the dashboard, you can use that information to see, how are you performing, and are you seeing any macro changes with particular payers within your census? So yeah, it's very useful to track those trends. And thank you for saying that, Peter.
Anyone else have a question?
Okay. All right, guys. Well, it sounds like we're wrapping up. Jakari, you want to go through and did you
we have the gift card contest, definitely. Okay. So while Ali was speaking, I was working on the Amazon gift card contest drawing, and Mr. Gregory Robertson is our winner. So congratulations, Gregory. So if you can do me a favor, just put your email address in the chat box, and we're going to email you your gift card. So just put it in the chat box, and we'll get that over to you today. So I appreciate everyone attending. Thank you so much. And Ali, thank you for that great presentation. And we'll see you guys at the next presentation.
Thank you, guys.